checked by them. Usually when a patient goes to an optical shop, they usually only check for the number of the eye. Unfortunately, they are not aware of other problems which are going on inside the eye, which can only be seen by a specialist using special machines, and obviously the specialist has to be trained in that particular specialty in order to pick up the findings. Retina and glaucoma are two such specialities. Retina and the nerve in which the problem happens leading to glaucoma, both are there inside the head. They are not visible from outside. So special techniques are used in order to check the retina and the nerve behind. Once the retina or the nerve are involved, it becomes extremely important to get it treated as soon as possible. The later we get the treatment done or the later we do the intervention, the chances of the outcome being very good are actually diminished. The earlier we intervene, we can give back almost near normal vision to the patient. One extra thing that I would want to tell is about the symptoms what the patients usually have when they have this retina or glaucoma issue. Majority of the patients will complain of 1. Reduction in vision. Number 2. Straight lines will start appearing wavy to them. Number 3. There will be something called as floaters. These floaters are black dots that are seen moving around in front of the eye. Whenever they look at the sky or a white background, they will see multiple black dots which are moving. That is called as floaters. Sometimes the patient have something called as flash. It is like a lightning flash inside the eye. It is when you click a picture, you get a flash.
I want to add on that unfortunately many a times I get referred patients who have been operated for cataract elsewhere in a non-comprehensive eye clinic. Once their retina and glaucoma issues are not taken care of and cataract is done just as a simple cataract surgery. Once the eye is not treated holistically, these patients unfortunately do not get great vision. They come back to us. We always ensure that any patient who comes to us, whether for cataract services, whether for glass checkup, whether for the patient is aware or not aware that the patient has a problem, we always make the patient undergo comprehensive eye checkup, because we have a team of super specialists and we ensure that any silent diseases inside the eye that can be missed, like the retinal and the glaucomatous issues that we are talking about, they are screened here with us. So many a times, like I've mentioned, that all these unfortunate patients, and many of them you must have dealt with them yourself, that many of them spend a lot on their cataract and on the choice of lens, etc., but they are not happy when they do not get great vision. So it is always best that you get a comprehensive eye checkup even prior to the cataract surgeries.
As we've already conveyed, this is a special wellness campaign specifically focused on glaucoma and retina. Yakandre, glaucoma, retina problems are usually ignored even by patients and ignored as far as awareness goes. Eye andre ella focus yavagalu cataract melene irutte. Glaucoma, retina are more serious problems than cataract for the simple reason that cataract surgery ಮಾಡಿದಾಗ vision ವಾಪಸ್ ಬರುತ್ತೆ. Glaucoma, retina problem early diagnose ಆಗಿಲ್ಲ ಅಂದ್ರೆ vision ಹೋಗುತ್ತೆ. So when vision is ಹಾಳಾದ್ರೆ ಅದು ಯಾವ ಸ್ಥಿತಿಯಲ್ಲಿದೆ ಆ ಸ್ಥಿತಿಯಲ್ಲಿ ಸ್ಟಾಪ್ ಮಾಡ್ಬೋದು, ಹೋಗಿದ ವಿಷನ್ ವಾಪಸ್ ಕೊಡೋಕ್ಕಾಗಲ್ಲ ರೆಟಿನಾ ಗ್ಲಾಕೋಮಾ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದ್ರೆ. ಸೊ ಇಟ್ಸ್ ವೆರಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ದ್ಯಾಟ್ ಗ್ಲಾಕೋಮಾ ಆ್ಯಂಡ್ ರೆಟಿನಾ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬೇಗನೆ ಡಿಟೆಕ್ಟ್ ಆಗಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಸ್ಟಾರ್ಟ್ ಆಗಬೇಕು ಟು ಪ್ರಿಸರ್ವ್ ವಿಷನ್. ನೀವು ಕಣ್ಣು ಮುಚ್ಕೊಂಡ್ರೆ ಸ್ವಲ್ಪ ಹೊತ್ತು ನಿಮಗೆ ಗೊತ್ತಾಗುತ್ತೆ, ಕಣ್ಣಿಲ್ಲ ಅಂದರೆ ಎಷ್ಟು ಕಷ್ಟ ಆಗುತ್ತೆ ಜೀವನ ಅಂತ. ಸೊ ಗ್ಲಾಕೋಮಾ ರೆಟಿನಾ ಯೂಶಲಿ ಎಲ್ಲರೂ ಇಗ್ನೋರ್ ಮಾಡ್ತಾರೆ. So along with Star Health Insurance, we want to thank Star for partnering with us. We want to raise awareness of glaucoma and retina, which typically people ignore. It is not enough, if you are above 40 especially, it is not enough ನೀವು ಆಪ್ಟಿಕಲ್ ಶಾಪ್ ಹೋಗ್ಬಿಟ್ಟು ಆ ಮಿಷಿನಲ್ಲಿ ಆಟೋ ರಿಫ್ರಾಕ್ಷನ್ ಮಿಷಿನಲ್ಲಿ ಟೆಸ್ಟ್ ಮಾಡಿಬಿಟ್ಟು ಚಶ್ಮಾ ಹಾಕೊಳ್ಳೋದು ಉತ್ತಮ ಅಲ್ಲ. ನೀವು ಆಫ್ಟರ್ 40 ನಿಮಗೆ ಏನಾದರೂ ವಿಷನ್ ಡಿಸ್ಟರ್ಬೆನ್ಸಸ್ ಇದ್ದರೆ, it can be blurring of vision, seeing black spots, which we call floaters, you have to come and get your eye screened for glaucoma and retina. And only when an eye hospital ನಿಮಗೆ ಗ್ಲಾಕೋಮಾ ಅಥವಾ ರೆಟಿನಾ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಅಂದಮೇಲೆ ನೀವು ಸೇಫಾಗಿ ಸ್ಪೆಕ್ಟಿಕಲ್ಸ್ ಹಾಕೊಳ್ಬೋದು. ಬಟ್ ಐ ಚೆಕಪ್ ಮಾಡೋದು ಅಗತ್ಯ. ಅದು ತುಂಬ ಮಿಸ್ ಆಗ್ತಾರೆ. ದೇ ಕಮ್ ವೆನ್ ದ ಪ್ರಾಬ್ಲಮ್ ಇಸ್ ಮೋರ್ ಸೀರಿಯಸ್.
I'm Dr. Niveditha. I'm the regional claims head here for Karnataka and I represent Star Health Insurance Company. So we are glad that Vasan Eye Hospital has come forward to support our customers and agents with free retina and glaucoma screening and super specialist consultations, which will be beneficial to all our insurers. So,
Madam, ಇದರಿಂದ ಬೆನಿಫಿಟ್ಸ್ ಏನಿದೆ?
Sir, I would like to tell you that see, most of the people in India are suffering from eye issues. So insurance is something that is covering eye issues. With, of course, there is a lot of terms and conditions, but most of the policies for from all the companies do cover eye health issues in the policies. So coming forward and creating this awareness from the hospital and the insurance side will be definitely beneficial to the customers. Now, Vasan being one of the largest group chain of eye hospitals, they are supporting one of the largest insurance company, which is a private insurance company in India. So we are hoping that we can reach out to maximum customers, maximum people out there to give a better service. And when it's something like support with the best doctors around and giving a free service, I'm sure that will also bring in more people to come and get their eyes first screened, because most of them, when you see retina and glaucoma, it is not something like vision where it starts with a blurred vision and a person can actually get to know he has power or not. But when it comes to glaucoma and retina, there can be sudden changes in the eye or sudden blindness. So having a glaucoma, firstly ಗೊತ್ತಾದ್ರೆ it is better to save the eyes. ನೀವು ನೋಡಿರ್ತೀರಾ, ಯಾರು ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಅಲ್ಲಿ ಫಸ್ಟ್ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಸರ್ಜರಿ ಮಾಡಕ್ ಹೋಗಲ್ಲ, ಅದು ಫುಲ್ ಡೆವಲಪ್ ಆದ್ಮೇಲೆ ಮಾಡೋದು. ಬಟ್ ಇದರಲ್ಲಿ ನೀವು ಗೊತ್ತಾದ ತಕ್ಷಣ ಶುರು ಮಾಡಿದ್ರೆ ಅಲ್ಲೇ ಅರೆಸ್ಟ್ ಆಗತ್ತೆ, ಫರ್ದರ್ ಡ್ಯಾಮೇಜ್ ಆಗಲ್ಲ ಐಸು. ನೀವು ನೋಡ್ಬಹುದು, ಜಾಸ್ತಿ ಜನ ಫ್ರೀ ಐ ಚೆಕಪ್ ಅಂತ ಎಷ್ಟೋ ಆಪ್ಟಿಷಿಯನ್ಸ್ ಹಾಕಿರ್ತಾರೆ, ಅಲ್ಲಿ ಹೋಗ್ತಾರೆ, ಅಲ್ಲಿ ಚೆಕ್ ಮಾಡಿಸ್ತಾರೆ. ಬಟ್ ಈ ಡೀಪರ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಯಾರು ಚೆಕ್ ಮಾಡಲ್ಲ. ಅಂಡ್ ಪ್ಲಸ್ ಈ ಪ್ರಾಬ್ಲಮ್ಸ್ ಜಾಸ್ತಿ ಮಿಡ್ಲ್ ಏಜ್ ಅಲ್ಲಿನೇ ಬರೋದು, ಎಸ್ಪೆಷಲಿ ಇಫ್ ಸಮನ್ ಹ್ಯಾಸ್ ಮೋರ್ ಆಫ್ ಕೋಮಾರ್ಬಿಟೀಸ್, ಏನಾದರೂ ಹೈಪರ್ ಟೆನ್ಷನ್, ಡಯಾಬಿಟೀಸ್ ಎಲ್ಲ ಇರೋರಿಗೆ ಇದು ಇನ್ನೂ ಜಾಸ್ತಿ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಬರೋಕ್ಕೆ. ಸೊ ಇದು ಒಂದು ಆಪರ್ಚುನಿಟಿ ನಮ್ಮ ಜನಕ್ಕೆ ಇದು ಗೊತ್ತಾಗಬೇಕು, ದಟ್ ಅರ್ಲಿಯರ್ ಡಯಾಗ್ನೋಸ್ಡ್ ಅರ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ವಿಲ್ ಸೇವ್ ದ ವಿಷನ್. So this is a very good initiative taken by the team here to come forward and give an open door for all the needies in the sector here. And I